Heart patients, did you know that you're at increased risk of myocarditis and pericarditis after receiving the COVID vaccine? Hi, and welcome. I'm Christian from Cardiac Rehab Online, a channel where we discuss information related to improving cardiac health. So this week we're looking at the most recent scientific data and reports relating to increased risk of myocarditis and pericarditis. In this video, we will look at some of the symptoms to look out for and how to adapt your current lifestyle, especially relating to exercise. So, relating to COVID, if you're a heart patient, as I'm sure you're well aware, you're in a high risk category. And I'm sure many of you have been following the events of the last few years avidly. Many of you have followed the guidelines from the government and their scientific data and chosen to be up to date on your COVID vaccination schedule. Okay, great. So you're fully vaccinated. However, you may not have been informed or realized, because it's not been really reported in the mainstream media, that there are potential side effects. In fact, the CDC in America have recently been compelled by a judge to release their clinical data on the vaccine trials, that they initially tried to have this data sealed for 75 years. For some reason, they don't want this in the public domain. The findings of this data in one section of the report on page 30 include 1,294 potential side effects. The report goes on to detail many other health aspects, but I wanted to focus on just two for today that may well impact heart patients' health and is something that you, being a heart patient, would be wise to look out for. The two in question are, as we said earlier, myocarditis and pericarditis. So let me explain a little about what these are and how they can affect you. So myo means muscle and carditis means inflammation, or another term is cardiomyopathy. And pericardium, which is the lining that the heart is situated in. Common causes of these two issues can be from viral, bacterial or fungal infections, also commonly a chest infection and autoimmune disease. Autoimmune disease is when your own immune system attacks your body. Now, this results in a lack of function in the heart muscle, which has a direct impact on the volume, intensity, and duration of workload that the heart can sustain. So, specifically relating to heart patients, when you exercise or undertake any strenuous activity around the home or at work, the heart is going to be under increased pressure to perform, which may well lead to further health issues, including heart attack. But we've seen from recent research increased risk of myocarditis in the vaccinated population. The link for this research is below in the description, and there is also a very informative video on this topic from Dr. John Campbell. Again, the link is below, so if you'd like to follow up on this, feel free to do so. So what symptoms should you look out for? Well, we've got shortness of breath, decreased ability to exercise, irregular heartbeat or palpitations, stabbing pain and or tightness in the chest, which may spread across the body, difficulty breathing when resting, and flu-like symptoms. Now, if you have symptoms, I would, as a matter of urgency, make an appointment to see your doctor to discuss this matter. If the symptoms don't go away, you may need tests such as an electrocardiogram, ECG, to check out for abnormal heart rhythm. If you have experienced palpitations, a chest x-ray to check for fluid in or around the heart, or an echocardiogram. Treatment for myocarditis usually depends on the cause. It can involve close monitoring and medication, including anti-inflammatory medicines and antibiotics. In long-term cases, myocarditis can affect your heart muscle and tissue, meaning you could develop heart failure. Okay, so let me summarize what we've shared with you today. So it makes sense to be aware of the symptoms of myocarditis, as there is an increased risk. Now, we know that when you increase your heart rate through exercise, that it places more demand and workload on the heart and vascular system. If you have myocarditis, the inflammation within the heart results in a reduced capacity to perform. When this happens, you're at an increased risk of a heart attack. So I would highly recommend that before you exercise, make sure you run through the pre-exercise checklist. It's in one of my previous videos called Heart Patients Don't Exercise Until You've Seen This, and for good reason. So there's a link below in the description to get the free download. It only takes a minute to run through, but it might just save your life. If you have been having symptoms, let us know in the comments section below, because there may be many others just like you. I'm interested to know what is happening out there, and if there are anything we can do at Cardiac Rehab Online to help you. So guys, remember to subscribe to the channel and get the latest videos straight to your inbox. In health and happiness, goodbye. See you next time.